Hi, I'm your Rite Aid pharmacist. Last flu season was the worst in nearly a decade. So this year, it's even more important to come get your flu shot. It's free with most insurance, and you don't need an appointment. You'll be protecting yourself and everyone around you. So stop by your local Rite Aid today and help us create a flu-free community. Vaccines available while supplies last. Age restrictions apply in some states. See pharmacist for details.
Blog Talk Radio.
Welcome to Partners in Health and Biz with your host, Gail Dixon. Tune in every Saturday, 9 a.m. for great shows about obtaining and maintaining health, business, and finance. Learn from the experts here at PIHradio.net. And now, broadcasting from the Partners in Health and Biz studio, here's Gail.
Well, good morning, everyone. Welcome to Partners in Health and Biz. I am so very happy you could join me this morning. This is a wonderful, beautiful day. This is the day that the Lord has made, and we will rejoice and be glad in it. And today's show, 5 early warning signs of prostate cancer. Wow, as you may know, and if you don't know, September is Prostate Cancer Awareness Month. And so we want to provide this show, we plan this show, and we know that for years, women have been encouraging our men to get tested for prostate problems. Many men have ignored the early warning signs because you were not aware that these symptoms that you were having were an indication of a growing condition. So today, I have a special pre-recorded audio by Dr. David Brownstein. Dr. David Brownstein, and he will be talking about the connection between iodine, prostate, and other cancers. Dr. David Brownstein is a family medicine and holistic practitioner, and he has been practicing medicine for well over 20, 30 years. He has written multiple books. And if you'd like to find out more, you can always Google Dr. David Brownstein, and that's Brown, Brownstein. There's also a website I'd like you to investigate. It's called thetruthAboutCancer.com. So you can go there and you can find out a lot of information, also additional information, lots of videos and other doctors and health and wellness professionals on that site. Again, that site is thetruthAboutCancer.com. Also, this morning I'd like to share with you from a naturopath that she's actually my naturopath, has been one of my naturopaths for years. And her name is Dr. Andrea Sullivan. She practices medicine in Washington, D.C. She has a practice on Connecticut Avenue, Dr. Andrea Sullivan. And she has a book called A Path to Healing. A Path to Healing. Dr. Sullivan is one of the nation's leading naturopaths. And A Path to Healing is a guide to wellness for body, mind, and soul. So she talks about, in her book, in one of the chapters about cancer, and says that African American men have a higher overall cancer rate than any other racial or ethnic group in America. African American men have higher incident rates of cancer of the prostate, lung, and oral cavity than any other ethnic group. They also have the world's highest chance of developing, along with the highest mortality rate from this disease. White men, she says, have a higher 5-year survival rate than African American men, and this may relate to the fact that higher animal fat consumption may be associated with a higher risk for prostate cancer, as it is for breast cancer, and that African American men typically consume more animal fat than their white counterparts. In addition to the dangers of poor diet, we know that all cancers caused by cigarette smoking and heavy alcohol use could be prevented completely. So she talks about a little more about the connection between about cancer and lung cancer. But prostate cancer, she says, although it is beyond the scope of this chapter that I'm talking to you about, she says that prostate cancer is becoming an increasingly important issue because it is the second leading cause of cancer death among specifically African American men behind lung cancer. And she says she strongly urges all African American men over 40 in her practice to have a prostate examination yearly, especially if they have a family history of cancer, if they come in contact with chemicals or toxic waste on a regular basis, or if they smoke or drink excessively, and this could be for all men, but specifically in terms of how often for African American men. Also, men in general who have a vasectomy are believed to have a higher or a greater risk of prostate cancer. A prostate examination includes, in case you don't know, a prostate examination includes a routine rectal examination and blood work. That's why many men shy away from having this exam, but it's very important that they have it. The person may experience pain with urination or ejaculation and rectal pain during bowel movements. Men, you can have pain in the back of the legs and hips that may also indicate prostate problems. But any of these conditions can also be signs of benign prostatic hyperplasia, which is not cancer. So that's the other thing. A non-cancerous condition of the prostate, and that's called benign prostatic hyperplasia. If diagnosed in the early stages, prostate cancer can be treated and cured in most cases. However, in terms of the African American population, most black men do not want to go through the discomfort of a rectal exam. A doctor who feels something suspicious in the rectum will usually order a biopsy of the area. If the biopsy tests positive for cancer, the doctor will then order more tests, including x-rays and blood work to determine whether the condition has spread to other parts of the body. If the tumor is small and localized, surgery alone may be sufficient to remove it. If the patient is older, the doctor may have to perform radiation treatment. Now, a 1993 report in the Journal of the American Medical Association states that prostatectomy the removal of all of the part, the removal of all or part of the cancerous prostate gland and radiation may not be the best treatment for prostate cancer. The report states that it may be better for the patient to monitor the tumor's progress and withhold treatment until absolutely necessary. Now, naturopaths believing this wait-and-see approach may be the best alternative for prostate patients, will prescribe natural remedies in the meantime. Now, there are herbal treatments and nutritional supplements that the naturopaths will recommend that you take. If you can get a copy of Dr. Andrea Sullivan's book, she speaks about the herbal treatments and nutritional supplements that men can take in her book on page 242. If not diagnosed or treated in time, however, prostate cancer can spread to any organ in the body. The most common sites for its spread are the bones and lymph nodes. With such a diagnosis, chemotherapy or hormonal therapy is absolutely necessary. So if you wait until you have these symptoms and you ignore them, and you continue to age and your symptoms continue to get worse, then it can come to the point where you must be treated with some of these more invasive therapies, the chemotherapy the chemotherapy, and the hormone therapy. So that is like the introduction of this show, and we're going to listen in a minute to Dr. David Brownstein, again, family medicine and holistic practitioner. Here at Partners in Health and Biz, we do believe in both holistic medicine and, of course, the that's the main thing here, the holistic part of treating. If you can prevent a disease or a condition by eating healthy and exercising and doing things that are natural. However, it's also, there comes a point where you cannot just depend on natural. If your condition has gone too far, you must seek medical help from a MD. A naturopath is an ND, a doctor of natural medicine, and an MD, of course, is a medical doctor. Both go to school to learn about medicine and how to treat people medically, but the naturopath treats more with the natural medicines. That's what the herbs and the tinctures and things of that nature. So I will like to give out the call-in number this morning. In between the next audio you will hear from Dr. David Brownstein, we will have a break in between. The call-in number is 347-945-7433, 347-945-7433. Press 1 if you have a question or a comment, and you don't have to do anything if you just want to continue to listen to the show. So right now we're going to hear a word from one of our sponsors, and we'll be right back, and then we'll jump right into our audio from Dr. David Brownstein. Stay tuned. We'll be right back. Let's be creative with Carrie. Caricatures by Carrie, available for weddings, parties, anniversaries, corporate events, and more. Children's book author, superheroes, and cartoon illustrator, logo and graphic designer. Contact Carrie for your customized creations. Caricatures by Carrie at gmail.com. Connect on Twitter and Instagram with hashtag CaricatureCarrie and check him out. www.carriegjohnsondraws.com. Yes, we're back. In case you're just tuning in, you are listening to Partners in Health and Biz. We are broadcasting live, www.pihradio.net. I'm your host, Gail Dixon, and the topic this morning, 5 early warning signs of prostate cancer. The next voice you will hear is Dr. David Brownstein, family medicine and holistic practitioner. So enjoy, listen, take notes, and we'll be back after this audio.
I started looking at patients holistically about 20 years ago after treating my father. Was my first holistically treated patient. And I found that my father, who had a 25-year history of heart disease and continual angina, and seeing all the best doctors out there, was on 10 different medications. When I looked at him holistically, he had an unrecognized thyroid problem. And when I just got his thyroid working better, his 25-year history of angina went away. He felt better, he looked better, and acted better. And I started looking at every patient from that moment on for hormonal and thyroid problems. And ultimately, I came to find so many patients with thyroid problems that I started searching for an underlying cause of why are so many patients having thyroid problems. And about 12 years ago, I came to that. I did a study of iodine, and when I started looking at my patients and their iodine levels, I found that over 95% were significantly low in iodine. And when I started rectifying this with using the right kind of iodine, these patients started to get better from a variety of problems, including thyroid problems and breast problems and ovarian, uterine, and prostate problems, and we'll get into all that discussion. But that's how I started, and now I've been treating people with iodine for over a dozen years and seeing the great results with it. And the power structure didn't know about this, and that's why they iodized salt in the 1920s to prevent the goiter epidemic that was occurring. And the interesting thing was after the iodization of salt was hailed as one of the first public health miracles in the United States government, and it was. It really effectively treated a problem that was occurring at epidemic rates. It treated it cheaply. It treated it safely.